Hello everyone, hope you're doing well. Welcome to Chapter 2. We're going to talk a little bit about law and regulations that you're going to encounter in the healthcare profession. This is a really interesting chapter. Of course, make sure you read it in your textbook. I think you're going to get a lot out of it, and it's going to be really interesting for you to learn a little bit more in depth. And hopefully I can give some examples of some of the laws and regs that you're going to encounter in the healthcare setting, because there are some differences. So, of course, making sure we understand the chapter objectives. This is something good for you to look at prior to reading the material, but we're not going to go into this in a lot of detail. What we're going to start with is just an introduction to course regulations. So, as a healthcare professional, you got to be aware of a lot of different things, and some of the things that we need to be aware of from the perspective of regulations and laws are what's listed here. These are kind of the main points. So, medical practice, healthcare laws and regulations that govern that, right? So we've talked in the past about, being certified or being licensed in your profession. At times that is required to work in a healthcare setting from a clinical perspective. Of course, the nature of your employment. Sometimes you're an at-will employed individual based on the state that you're in. Sometimes you're union. There's a lot of things that go into that description. Discrimination. This is something that is not tolerated in the course, pretty much any setting, but in the healthcare setting especially. Sexual harassment, federal and state legislation, and union membership and collective bargaining. So I'm sure pretty much everyone is aware of what a union is. And I think a good example of this would be a nursing union from the perspective of healthcare. That is kind of the standard that we see in healthcare organizations today. But and this is mostly, I see this on the inpatient side of things. There are some ambulatory unions, but mostly that's on inpatient side. Ignorance of the law is not an excuse, right? You have to know the law. This is your profession, so you need to be prepared. If you break the law, you're going to have consequences. So from the perspective of that, I hope this chapter helps you navigate. So medical practice laws, of course, control the practice of medicine. So state legislators, they're going to establish medical boards that professionally govern how organizations practice medicine, how providers practice medicine. So licensing boards, of course, you got to get your license, right? Doctors, of course, have a license. We're going to talk from the perspective of an MD just as an example for this chapter, but an unlicensed physician performing procedures outside of scope that can, of course, cause harm, right, if they're not trained to do so. But we need verification from the state side of things. That's what licensing boards do, and they're really important. So just kind of a basic thing. I'm sure everyone is aware of medical practice laws from that perspective. You do also have the State Board of Registration, right? So state medical licensing laws regulate the State's Board of Registration. The board is made of experts who understand and know the laws. So they look at provider complaints. They investigate those complaints based on where they practice and what the complaint's about. And then they have the power to make conclusions according to the rules. So if a provider has a variety of different complaints, say based on their surgical care, and they have a lot of adverse patient reactions, the State Board of Registration is going to look at that, and they're going to evaluate whether or not that provider needs to continue to practice. So that's just one of the many examples of a State Board of Registration. All right, we're not going to do the knowledge check. Of course, you can take a look at it from the perspective of this, but it's going to be in the upload for the PowerPoint. There's a mandatory reporting. So healthcare is required to report the following things to the government: births, deaths, which are suspicious, abnormal, right? Communicable diseases, and injuries due to abuse. So let's talk a little bit about COVID-19. COVID-19 was mandatory reporting, right? Because we had to judge based on the scale of the U.S. how much disease we had in the community. On that knowledge, we're able to determine whether or not our cases are going up or down. So that's just one of the many examples of why the government needs to be involved in understanding what impact mandatory reporting has on the community. So births are another example, right? We want to see what our birth rate is for the United States overall, maybe for the state. If your birth rate's drastically going down, of course, that's going to make issues in the future. If it's going up, that could also be an issue. There's a lot of different examples here. So mandatory reporting is for a reason, and it's for the betterment of the community at large. And I'm talking the whole United States, so that's why it exists. So abuse, we don't often hear about this, but it happens all the time in healthcare settings, especially on the inpatient side of things. Providers or healthcare um, workers might see a patient that has been abused. That is mandatory reporting. Child Abuse Prevention and Treatment Act is one of the many pieces of legislation here to remember. It requires states to have programs to identify, prevent, and treat problems related to child abuse. Elder abuse is another thing that you're going to see. You talk about this a lot, especially in the home health side of things. It's really sad to encounter, but there are laws in place to, of course, prevent that, and then also laws to hold people accountable when this happens. We want people to be treated with dignity and respect, and when these types of situations occur, it is up to us as healthcare organizations to make sure that we're reporting them. All right. You could definitely take a look at the Child Abuse Prevention and Treatment Act, which is on the federal side of things. But the Controlled Substance Act, I'm sure you've heard a lot about it in the news, right? Controlled substances, it was a big thing, especially 10, 15 years ago. The opioid epidemic really hit home for a lot of our providers because back, 20 years ago, and I'm just guesstimating here on time periods, but it was highly suggested that, opioids be used for treatment, and the pharmaceutical industry really pushed this. But from the perspective of getting people addicted to these drugs, it really had a negative impact on our community at large. So providers have really scaled back in relation to prescribing opioids, and they try to hold people accountable so they don't accidentally or don't get into a situation where patients are abusing them. But this was kind of a standard a while back, and it's been really challenging for the healthcare community at large. So the Controlled Substances Act talks about drugs or chemicals that are maintained or controlled by the government, and it of course restricts the distribution and it's meant to make sure that we handle and prescribe in the right manner, right? Because drugs can be prescribed and used for the wrong reason. You've heard a lot of stories out there in the news about a patient being prescribed a drug and then going out and selling it to on the street to make money. A lot of different instances there. So we want to be careful with how we're prescribing things, and that's what the Controlled Substance Act does to protect our providers and our patients. All right. DEA. Let's talk a little bit about DEA. Enforcement agency is in charge of enforcing this Controlled Substance Act, right? There's a DEA association with every provider, so your DEA number, registration number for a provider. So when they prescribe a controlled substance or any prescription for that matter, they have to have a DEA number, and that kind of helps register prescriptions, right, on the government side of things to make sure that they're being watched and, of course, appropriately handled. So that's the DEA. They're responsible. The Drug Enforcement Agency is responsible for the Controlled Substance Act, and every provider has a DEA number prior to prescribing, of course, prescriptions. So controlled substance schedules, right? Each drug is going to have a certain schedule. So Schedule 1 drugs, Schedule 2 drugs, Schedule 3 drug, and this really talks about the dangers associated with these drugs. So I'm not saying that there's not a place for opioids, right? Especially in end-of-life care, some of these really challenging diseases. There are places in our treatment schedules or in provider treatment schedules for opioids and controlled substances. However, we need to make sure that we understand the implications of their challenges. So whether or not they are meant for the right thing or not, there are schedules that help providers understand their dangers. And pharmacists can really speak to this, but providers need to be aware of it as well. So remember, every provider has a DEA number, and this helps track what they've, of course, written out in prescriptions. A bit about the USP. The USP is a collection of drug information and standards published by, of course, this convention. So it has standards for prescription drugs, over-the-counter drugs, drugs intended for humans or animals, dietary supplements, and some food ingredients, right? hear about the USP in combination with the FDA a lot. FDA, of course, governs, right, when drugs can be released from the perspective of how they're supposed to treat disease or treat individuals who might need care. So from that perspective, right, the FDA and USP work together. All right, employment laws and equal opportunity, right? Employment laws seek to ensure that employees can work in an environment that's free from discrimination and harassment. It's really something that's standard. I think most organizations, do a pretty good job of making sure they have policies and procedures to highlight these employment laws. So employees do have rights. Let's talk a little bit too about the Equal Opportunity and Employment Act. So the Equal Opportunity Act from the Civil Rights Act of 1964 says, of course, that we cannot be denied employment based on our race, color, religion, sex, or national origin, right? Everyone deserves equal treatment, and we need to make sure that we don't have any discrimination from the perspective of who we employ and how they work on the job. So make sure you're aware of that. I think most people are. And there's a lot of great information in our book about the EEOC. When you hear about the EEOC, a lot of times it comes up from the perspective of interviewing. So when we're interviewing candidates, making sure that we don't discriminate based on their race, religion, age, all those pieces. Interview questions, they have to have a legal, permissible, and non-discriminatory purpose. And I honestly, when I do an interview, I have a set standard of questions that I use, and that's something that's standard across the organization. So they're protected, and we make sure we don't ask anything that might be inappropriate. And this really helps the constituents I have in the interview follow guidelines. So we do have pre-employment testing and drug testing. So we have to make sure those are carefully constructed and used in a way that avoids discrimination, right? And there's ways to do this, and this is not something that I think you need to be especially understanding of for this chapter, but just know that we need to make sure that when we're going about this process, we don't do it in a way that's discriminatory. Genetic Information Non-Discrimination Act of 2008. This is when healthcare insurers and group health plans are not able to deny coverage based on higher premiums of that individual. So if a person has a disease, right, and they want to get health insurance, a payer is not able to say, hey, because you've been sick in the past or you might cost more, we're not able to insure you. And this was one of the good things that came out of the 2008 Affordable Care Act legislation. So think about this from the perspective of it holds payers accountable to giving people the option to have health insurance, even if they've had communicable diseases or something from the perspective of that's going to cost more. So you can't say, hey, you've had an injury before or you've had this many issues, so you're not able to have our insurance. Unlike, when we insure our home or something else. Sexual harassment, unwanted activity in the workplace, right? Harassers can be peers, subordinates, supervisors, vendors, clients, and that is prohibited behavior from the perspective of verbal comments. All those examples right there are something that we really need to lead into from the perspective of understanding that this is not appropriate and there are laws to prevent it. Discrimination, we've talked about that a little bit from the EEOC, but the ADA is really what I want you to pay attention to here. So the Americans with Disabilities Act pretty much says similar things. So those who have physical disabilities should be treated in a way that they're not discriminated against in employment. So they need to be given the same opportunities everyone else is and given access in the workplace. So employers have a reasonable accommodation process which they provide to mental and physical limitations of individuals with disabilities. So a lot of times this is the ability for an organization to accommodate their needs, and I've seen it often. So our organization does a really good job of this, employing people, giving them the opportunity to make a difference where they're at and meeting them. And because these people are highly skilled people as well, we need to be able to give them the opportunity to do a good job. And I think from that perspective, oftentimes when we give people grace and we find the right fit, so finding the right fit for these individuals, it really helps them excel, and it helps the organization excel as well because it's the right thing to do. So we're going to continue this lecture on another video which I'll have here in a second. So we'll see you in a bit and we'll wrap this up.